what our project did was we took this entity called SeizureTracker.com, which is one of the world's largest databases of patient-reported, it's a patient-reported seizure diary. And we divided those people into 3 risk groups. Low risk for SUDEP, which we defined as having 0 generalized convulsive seizures per year, medium risk 1 to 2 per year, and high risk 3 or more per year. The high risk that was defined as 3 or more generalized convulsive seizures per year, that was based on previously identified SUDEP risk factors, and one of the strongest SUDEP risk factors has been having 3 or more generalized convulsive seizures per year. And so what we did was, taking those groups, we looked to see how they changed over time. So starting from year 1 to year 3, do people stay in the same risk stratification group that they started in year 1, or do they change over time? And what we saw was that people who are in the low risk group, who had 0 generalized convulsive seizures, the majority of them stayed low risk 3 years later, versus those that were in the high risk group, many of them actually left the high risk group by 3 years. So the takeaway from our study is that the people who are low risk for SUDEP tend to remain low risk, and those that are higher risk for SUDEP, they may change over time and they may move out of their initial high risk category. So from there, it's important that we look at our patients yearly and assess their risk for SUDEP, and then treat and counsel them appropriately about their risk. What was surprising to us, and one of the reasons why we wanted to do this project, is we wanted to see, does your risk for SUDEP, does it change over time, or is it static? If you start in a high risk group, will you always be in a high risk group? And this is important in terms of what we tell our patients. I think what this shows is that there is some hope. So people who are in the high risk group, there is hope that they could move out of the high risk group at some point. How they do that is not something that we had looked into, but it could be that we need to change medications for them, perhaps consider surgeries. There's other options, but I think that's useful to the providers to know, is that there is something to do for these high-risk patients. I think there's a lot of questions that are left unanswered. I think one of them is the why. So why would people move out of the high-risk group? The other question would be, we looked at one of the major risk factors for SUDEP, but there are many other risk factors that have been identified. So I think also to create a more comprehensive view would be helpful to have those other risk factors in as well.